Welcome to the CDC Diabetes at Work Project Conference Call. My name is Dawn, and I will be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. Please note that this conference is being recorded. I will now turn the call over to Dr. Ron Lepke. Dr. Lepke, you may begin.
Thank you. Welcome, everyone. It is a privilege and pleasure to have Dr. Pam Allweiss and Christina Ernst join us today. They are national thought leaders in the whole arena of diabetes and diabetes health management. Dr. Allweiss is an endocrinologist and preventive medicine physician with the Centers for Disease Control and Prevention in the Division of Diabetes Translation. She currently is the support person for the National Diabetes Education Program Worksite Initiatives and offers technical assistance for the public and private partners of the Business Health Strategy Stakeholder Group to develop materials and resources for employers about worksite issues and diabetes, such as the diabetesatwork.org website. In addition, Dr. Allweiss is on the steering committee of the National Center for Chronic Disease and Health Promotion business team. Projects include development of the Purchaser's Guide to Preventive Services, Heart Stroke Checklist, and others. She offers assistance to public and private partners such as National Business Group on Health, National Business Coalition on Health, and the National Safety Council. And Dr. Allweiss is on the clinical intervention team for the National Healthy Worksite Initiative from the CDC. Christina Ernst is a nurse and certified diabetes educator who joined the CDC's Division of Diabetes Translation in 2002 after 25 years of clinical practice as a diabetes educator. She is a program consultant who provides consultation and technical advice to program grantees and partners on ways to build the capacity and infrastructure to implement strategies related to the primary prevention of type 2 diabetes. Chris is a subject matter expert and a member of the CDC's National Diabetes Prevention Program team and the CDC Chronic Kidney Disease team. Join me in welcoming Dr. Allweiss and Christina Ernst. Pam?
Hi, thanks, Ron, so much. I'm so glad to be able to have the opportunity to present. I have presented some of this information before at various ACOEM conferences, and I'm very glad to have this opportunity again. Ron has also been involved with our group. We are trying to update this Diabetes at Work website that he mentioned, and we have a task group to do this, and Ron is the chair of this task group. So we have two goals for today. One, to show you resources that are in the public domain about work sites and diabetes, and then the other is to introduce you to the National Diabetes Prevention Program, and we'll talk about why and how in a minute. Both of us will discuss, and then we will show you the websites, and then we will have time for question and answers. All of the slides will be posted on the ACOEM website later on today, so feel free to go to the website and look. And if you have any questions, please feel free to email us as well. We also sent out some questions, some homework before the presentation, because we also would like your input. As long as we are updating some of these resources, we would like some help, and we would like your input on how to make things more useful. So why are we discussing this? We know we have an epidemic of diabetes. Our working population has many chronic conditions, and certainly the Health and Productivity Work Group of ACOEM is very aware of these problems. We have to balance having a healthy workforce. We need to make accommodations for people with chronic conditions, and we hear from a lot of people who have diabetes that they still feel a bit, quote, discriminated against because of their conditions. But the worksite can be a wonderful place for education, as all of you know, and the return on investment is very, very good, especially with primary prevention of diabetes, which we'll talk about later. We know now that 26 million people have diabetes. Many of them don't really even know that they have diabetes, so some people are walking around for 10 years with diabetes and they don't even know it. but 79 million people have prediabetes. Their blood sugars are higher than normal, but not high enough to fall into the, quote, classic diagnostic criteria of diabetes. But these folks definitely have an increased risk for macrovascular disease, for heart disease, and for stroke. And we have evidence-based interventions that can really help prevent type 2 diabetes in those who have prediabetes. We know that if current trends continue, 1 in 3 people will have diabetes by 2050, and the cost is $174 billion and going up depending on what study you're looking at. CDC is known for all of its maps, so we certainly like to look at why is there such an epidemic of diabetes. And certainly we see that from 1994 to 2008, the percentage of people who were obese, a BMI of over 30, certainly went up dramatically. And you can almost overlay the obesity slides onto the diabetes slides, where we find that in some communities over 9% of the people have diabetes. So we definitely have a problem, and we need to look for solutions. Now, there are a couple of areas where people really are not overweight. This is an old slide, and it used to be Beverly Hills and Manhattan. It is now actually Boulder, Colorado, and Washington, D.C. But the rest of the United States definitely has an obesity or diabesity epidemic. And as I said before, 1 in 3 people will have diabetes by 2050 if current trends continue. Now, I know all of you know certainly about diabetes, but when we're talking about worksite issues, there's some things that I found that people are very concerned about. Some people say, oh, this person has diabetes, and we worry about the complications, not just the diagnosis of diabetes that can cause the problems. We also see that at least at the worksite, hypoglycemia seems to be one of the biggest concerns. So we always want people to realize that not all therapies for type 2 diabetes can cause hypoglycemia, and that is a mistake in the slide, and I will fix that. And we also want you to remind you that many people are afraid to tell their supervisors, et cetera, that they have diabetes. Now, do any of the interventions work to control blood sugar? We say to control the ABCs. A1C, which is average blood sugar control, B would be blood pressure, and C would be control cholesterol. And we know that controlling blood sugar really counts. For every 1% of hemoglobin A1C, which is your average blood glucose over time, for every 1% decrease, you can decrease the complications in the eyes and the kidneys, at least microvascular disease, by up to 40%. So that's a pretty impressive reason to do this. We know that fewer complications will translate into fewer days lost to absenteeism, presenteeism, and we know that there will be fewer accommodations that may be needed as well. Why pick diabetes for health promotion intervention? Certainly, we talk about many chronic conditions, and we certainly want to integrate diabetes with other chronic conditions such as heart disease, smoking cessation, etc. We know that we have effective interventions, evidence-based, that will work. We know that many employees, either currently or later, have diabetes or may be at risk for developing diabetes, and it's a unique opportunity for education. So we also know that when you promote employee wellness, you have decreased costs. When you look at hemoglobin A1C values, average blood glucose values, as they go up, so the average blood sugar over time has increased, the expenses go up. And as the hemoglobin A1C goes down, the healthcare costs go down as well. So that's one measure of return on investment. Just want to give some examples of why we really try to educate the worksite providers about education. I saw a patient who was a box cutter, and every morning at 10:30 he would, quote, fall out. And he was working with some very dangerous equipment. When we went to the factory, I said to him, well, he was on insulin, so do you take your insulin every morning at 7 o'clock? And he looked at me, he said, yes, how did you know? because he was on a combination of NPH and regular insulin, and I knew that his regular insulin would peak 2 to 4 hours after he took it. When we started educating everyone, we changed the type of insulin he was on. We gave him short-term accommodations with another job, and everything was safe for him and for the other employees. We also have to look at short-term use of insulin. I saw a patient who had type 2 diabetes. They wanted to get his blood sugar levels under control. He was driving a forklift. How do we deal with some of these issues? And then how do we deal with the disposal of needles and pens, certainly at a work site? We also need to talk about multiple ADAs, the Americans with Disabilities Act, the American Diabetes Association, etc. And also shift work is an issue for people with diabetes. So we have all kinds of issues that we have to address. Just a basic type of thing we like to look at is, does a person have a desk job? Are they more active? What are their physical requirements? Do they need special licenses or qualifications? So as I say, for diabetes, yes, it's a chronic condition that we can integrate into treating people with chronic conditions at the work site, but people with diabetes have some specific considerations as well. Since I work for CDC, we are into public health, and we look at community partners. So we look upon where people live, work, and play as all of our partners. And certainly the work site is a wonderful community partner with public health. And we have a lot of opportunities to open up the doors between businesses and community health. One of the resources I wanted to talk about was the National Diabetes Education Program, and it's a joint CDC and NIH program that's been around now for almost 15 years. We have over 200 partners, and we try to increase the awareness about diabetes and also develop products that people can really use. We have various stakeholder groups. We look at people with an increased burden of diabetes. So we look at ethnic minority groups, African American, Asian Pacific Islanders, Native American, Alaskan Native, certainly Hispanic Latino populations. And we also have a business stakeholder group, and actually ACOEM has been involved for many, many years in this group. We have many different materials for primary prevention of diabetes, education materials for providers, for patients in multiple languages. Everything is in the public domain, so if you have a wellness program, you are welcome to use our materials. We encourage you to use the materials, and you can certainly put your logo on it. Scrolling down to who the Business Health Strategy Stakeholder Group would be, certainly CDC and NIH, but we have worked with GE, GM, Land's End, ACOM, AOHN, Chambers of Commerce, National Business Group on Health, the National Business Coalition on Health, and America's Health Insurance Plans. They have all helped us to develop our materials. It actually started out with the wellness coordinator from GM who came to CDC and said, I would like an epidemiologic approach to chronic diseases like diabetes. So that's why we're here. We developed a diabetesatwork.org website, and we'll go through this later. But basically, it is geared toward providers and towards patients. And we're trying to update the content and the gaps. You can download many things. For instance, we use the assessment tool from ACOM, the Blueprint for Health, so that people can get an idea, a rough idea, about what the burden is of diabetes in their population. We hear time and time again that smaller businesses need to have resources, that the big guys have all kinds of stuff. We needed stuff for smaller businesses. We have stuff on general diabetes education, food complications, lunch and learn topics that you can just download. One of my favorites is choosing foods and beverages for healthy meetings. It really gives a very good outline of if you're going to have a meeting, be sure that you at least try to serve some healthy things. We have something on shift work, and as I said, no copyright at all. And at the end, we have a link, and we will hook you up to it. Some words of wisdom: you can't transform everything at once. please look at some of the things in the public domain and see how you can adapt them for your particular business. I wanted to give you some examples, and these are some of the case studies, both that are on our website, and also we've taken some of these case studies and we've put them in the ACOEM Health and Productivity Toolkit as well. So we've worked with Lockheed Martin, Land's End, and GM. One example was the GE Energy, GE Power project. We identified a population at high risk for developing diabetes and other cardiovascular problems by doing serial cardiovascular risk assessments. They had a wonderful program, and then they used some of our diabetes at work materials as well, and they adapted them for their particular participants. When we wanted to look at, quote, customer satisfaction results, people definitely were very happy to see it. They felt that they learned about the risks and management of their diabetes and other cardiovascular risk factors. But basically, they downloaded some of our lesson plans. Another example is TRAIN, otherwise known as American Standard, now Ingersoll Rand. I met the occupational medicine doc at Kroger one day, and they had a vendor, but they set up a wonderful partnership with the community hospitals, the university, community groups like the American Heart Association and the American Diabetes Association, and the National Diabetes Education gave them technical support. They used the fact sheets from Diabetes at Work, and they had two messages: control your diabetes, and also if you have risk factors for diabetes like prediabetes, how can you prevent type 2 diabetes from occurring? The Fayette County, which is Lexington, Kentucky, health department nurse, and this is the nurse in person, came to the work site. It was a partnership of the community and of private business, and we did a Wheel of Diabetes Fortune, and this is how we taught the people. Again, we wanted some evaluation. The people really liked it. We asked them, well, why wouldn't you show up? They talked about going on strike. One person said wild horses couldn't keep him from coming, but basically it was very successful. We learned that we had to work with existing programs. They had a vendor. We worked with the vendor. We included the health plan, and we, of course, had support from the top. Now, we're going to transition, and we'll turn it over to Chris Ernst. After Chris, we will go over the website to show you some of the website, and then if you did your homework, we will ask some questions. But a big thing is please don't forget about diabetes prevention. The National Diabetes Education Program has some materials, and now we have a new National Diabetes Prevention Program, which we will discuss as well. But we know that we have evidence that people with prediabetes can prevent diabetes. We know this was based on the science of the Diabetes Prevention Program, where you could prevent type 2 diabetes if people lost 5 to 7% of their body weight. So that would be 10 to 15 pounds if a person weighed 200 pounds. And if people walked 30 minutes, 5 days a week. These were evidence-based interventions. They compared the other group using metformin, and the people with lifestyle actually had better results, that they could decrease their risk by almost 60%. So this was very, very encouraging. NDEP also has some resources as well, like Get Real, you don't have to eat like a bird to prevent diabetes. People feel overwhelmed, so that when they know they don't have to lose 82 pounds, it's really, really important. You may have seen something in the New York Times a couple of years ago about an insurer's new approach to diabetes, and this was referring to the partnership of NDEP, of the National Diabetes Prevention Program, CDC, the YMCA, and United Healthcare, who all got together to offer an evidence-based 16-week program to identify people with prediabetes and then to implement these resources. Just the last slide I wanted to give you, and this will be posted, is that the CDC also has some general health promotion toolkits and portals as well. So I'm going to turn it over to Chris Ernst, and she's going to be talking about the National Diabetes Prevention Program. Chris?
Thanks, Pam. Thanks, everybody. I'm delighted to be on this call with you. What you've got here on this slide is the face page for the National Diabetes Prevention Program homepage. Let me see if I can pull up my slides for a minute. There we go. And this is who I am. I'm Chris Ernst. I'm a program consultant here with the National Diabetes Prevention Program. What we know about the Diabetes Prevention Program, which was the sponsored study through the National Institute of Health, that's been out for about 20 years now. And it takes 10 to 20 years for science to actually be translated and put into action into the community. We know that the DPP, the 5 to 7% weight loss, worked in all ethnic groups, all races, both male and female, all ages. And the good news is that with a 5 to 7% weight loss, people were able to achieve almost a 60% reduction in the incidence of type 2 diabetes, compared to the medication group, which was metformin. They were able to achieve about a 30% risk lowering compared to placebo, which is illustrated in this slide here. What we also know is that there were certain benefits, health outcomes that were achieved with the Diabetes Prevention Program. That is, it prevents 15 new cases of type 2 diabetes, treating high-risk adults for about 3 years. It'll prevent 162 missed work days. It avoids the need for blood pressure, cholesterol pills in at least 11 people, and it adds the equivalent of 20 years of perfect health. So these health outcomes are pretty significant because they avoid about $91,000 in health care costs. The cost of the Diabetes Prevention Program, it was delivered in a one-to-one format. That is, a diabetes educator followed a participant for the duration that they were enrolled in the study. For 12 months, the first 12 months cost around $1,400 per participant. The 3-year cost was about $2,780 per participant. With inflation, 3-year cost of the program exceeded $3,500 per person. That's fairly significant, and so some researchers at Indiana University, Marrero and Ackerman, looked to see could this be translated into a group series of classes. And they were very successful, Ackerman and Marrero were. They found they went to the Y, a community setting, and began delivering the 16-week core lifestyle program to folks that were coming into the Y. And this was so successful, they saw the same results as were achieved in the actual Diabetes Prevention Program trial, clinical research trial, that Congress in March 2010 passed legislation that specifically addressed primary prevention of diabetes. What the law specifies is that a grant program for community-based diabetes prevention program should work with different model sites to see if this worked on a widespread basis. A program within CDC to determine if eligible entities could deliver this community-based diabetes prevention service out in the public, a training and outreach program for lifestyle intervention instructors, and finally, evaluation, monitoring, and technical assistance and applied research carried out by the CDC. So we were authorized by Congress for this work. Now, the cost of a group-based format, what we learned is that it's between $275 and $325, or around $300 per participant when using trained lifestyle coaches. In other words, the Y staff. When delivered by certified diabetes educators, it's a little bit more, around $550 per participant. Still pretty significant savings over the one-to-one format compared to group. Once again, another slide that shows the per capita cost of the lifestyle intervention in the U.S. For intensive lifestyle, $1,500 for the first year. Group lifestyle, $300 to $450, and compared to the group lifestyle at the YMCA of $240. How much should the lifestyle intervention cost in order to save money? Our scientists, our health economists here at CDC were looking to see this, and over the years they found that in delivering the healthcare costs for persons with prediabetes, those that received the diabetes prevention program lifestyle curriculum compared to those that did not, the costs that were avoided each year ended up being about $300 per person for those that actually enrolled in the lifestyle program. The goal of the National Diabetes Prevention Program is to systematically scale the translated model of the DPP for high-risk persons in collaboration with community-based organizations that have infrastructure, the capacity, health payers, healthcare professionals, public health, academia, and others to reduce the incidence of type 2 diabetes in the United States. That's our overall goal, and we're on our way with that. There are 4 components to the National Diabetes Prevention Program. I very briefly mentioned this, but the first is the training, which is to increase the workforce of trained lay health workers that can implement the program in a cost-effective manner, that is, in a group setting. We anticipate that the most efficient group is about a group of 10 to 15 people, although in Montana we know that they deliver much larger classes, almost 30 people in a class. Our recognition program is known as the Diabetes Prevention Recognition Program. It's CDC's runs this program basically. There's not a fee for CDC recognition, but basically it's a recognition program that assures the quality of the program, that looks at the evidence to ensure that the classes are delivered according to the science base. It allows CDC to develop a program registry, which I'll show you when we go to the websites, and it may facilitate reimbursement. Right now, United Health Group is the only third-party payer. United Health Care in their strategic areas where they're actually reimbursing the Y on a pay-for-performance basis for the delivery of the lifestyle program to the participants. And participants, part of the outcomes that are being looked at include the participants tracking their physical activity up to 150 minutes per week or more, and a weight loss of 5 to 7%. The intervention sites around the country that deliver the program, we've reached over 1,000 people have been through the program so far at 46 sites around the country. So we're continuing to develop intervention sites that build the infrastructure and provide the program. And it's not just at Y sites that we hold these programs. I'll talk about that in 1 minute. Finally, we have a health marketing to support program uptake. We've done focus groups and found what ways best reach the people, what messages resonate with the folks that are at high risk, what resonates with healthcare providers and the referrers to the program. And we will be providing this support to the program so they can help fill the seats. The current status of the National Diabetes Prevention Program, the training, we contract with Emory University to create the Diabetes Training and Technical Assistance Center, and they in turn developed a master trainer curriculum to train the lay health coaches. And this is patterned after the Diabetes Prevention Program clinical research trial. The curriculum is It's just been reformatted to fit a group program rather than one-to-one counseling. The recognition program I just talked about, we've already started accepting applications, and at this point we have 37 programs with preliminary recognition. Our inaugural partners include the YUSA, United Health Group, and State Diabetes Prevention and Control programs. They do help to promote referral to the programs. Why the Y? Well, because there's such a huge network of Ys across the country. They were the first to jump in and say, hey, we want to be part of this when we held our first policy meeting back in 2009. And it's pretty interesting that 50% of U.S. households are located within 3 miles of the Y. You can see it's heavy in the east, a little lighter in the west, but we're still managing to get the word out. The Y is not our only partner. We also have interested community partners, including community-based organizations like Parks and Recreation. But what is really important for this partnership to work is we've got a community clinic model. The clinic model is where the patient often becomes activated to begin, and that's very true for employers too. They activate patients to seek out structured lifestyle programs that will help prevent type 2 diabetes. The decision support is also made in the healthcare system where the person is diagnosed, and it also returns for follow-up post taking the course. The intervention sites, as I mentioned, we've got, that should be 24 sites for program delivery, 246 sites for program delivery, and we've reached over 1,000 people who have enrolled in the program. And I mentioned the health marketing. United Health Group began providing reimbursement to the Ys to deliver the lifestyle intervention back in October of 2010, and as I said, that's on a pay-for-performance basis. CDC's approach to realizing this vision is to really provide, we've provided the core curriculum for people to look at and to begin delivering in sessions to attract health payers funding to support long-term sustainability of diabetes prevention program. One of the primary care teams goes out to different sites around the country to talk with the community, the payer community, the people at risk, and the organizations that are interested in providing this service. Recognition is free. There's no cost for recognition, and we do in turn believe that this is going to be facilitate reimbursement because it is merit-based. Its recognition is earned and then re-recognized as long as the standards are met. We hope that the partnerships that we have available will lead to greater accessibility of the National Diabetes Prevention Program in local communities. Right now we're around the country, and they're in 26 states currently. And I think we're going to go to the websites next.
Thanks, Chris. This is Pam. As long as we just finished with the National Diabetes Prevention Program, we'll look at that website, those websites first, and then we'll go back to Diabetes at Work so you can see that. So I'm going to, Chris, here's the prevention website.
With this website, let's see if we're down here under the program topics. It talks first. It'll click to about the program. You can see in your left-hand column where it lists all the different topics. I'm going to quickly go to where the funded sites are, and you can see we have a map, and it will allow you to go down and look at the sites on that particular link. The recognition program is how you get to where the curriculum is. This includes all the standards that must be met. And if you're interested in the curriculum, we have both the 16-week core curriculum as well as the post-core curriculum. participant handouts are included. The post-core curriculum is included, so you can click on all of this, which is pretty amazing. If you wanted to actually, I'll take you to that page, the Diabetes Training and Technical Assistance page of Emory can tell you all about where you can go for training. And again, on this page, you can see diabetes prevention, learn more about the training program. They want to know who is coming to the site, so they can contact you with updates if you're interested, or you can click no thanks and just instead go directly to where you can find different aspects where organizations can go. This talks about the National Diabetes Prevention Program. This talks about the Lifestyle Change Program and includes the curriculum. This talks about where you would send a coach, the person that actually teaches the Lifestyle Change Program, and that will take you to information about training of lifestyle coaches. And this tells you a little bit more about the curriculum. And of course, if you want more information, you can always contact DTAC. And now I'll switch back to Pam so she can pull hers up.
Thank you. And certainly this is wonderful for primary prevention. And what do you do for the people who already have diabetes? And we're going to switch to diabetesatwork.org. And when we were asking you the questions, we're very interested to know where you get the materials that you use for your folks who either have diabetes or who are at risk for developing diabetes. When you look at this website, we really would like your feedback on where are the content gaps. We'd also like to know, for instance, the best way of contacting people, of teaching people as well. Everybody has a different way of learning. So could it be a programmed learning or whatever? But if we get started and if we go down to the assessment tool, you can see, how much is diabetes going to cost your company, etc. And we certainly link to ACOEM's blueprint for health so that people can get an idea. We understand that many companies have a different amount of experience in worksite wellness programs. We have some general concepts about health and productivity, and we do link to ACOEM Health and Productivity as well. Our most popular things are the lesson plans and resources for people with or are at risk for developing diabetes. We have PowerPoint slides. We have things in English and in Spanish. So we tell people about what is diabetes, what are the complications. We tell people about foot care, tips to help you stay healthy. So if you're sponsoring a lunch and learn, or if you have any support groups or anything like that, here are some materials that you can just download. Certainly, program evaluation is very important, and we do have some tools for gathering help to design an evaluation program. And we also link to some of the other CDC worksite wellness evaluation programs, not just for diabetes, but for any type of program. We also have some success stories. We will be updating these as well, but these were from some of our partners who definitely implemented the Diabetes at Work materials. So we just kind of wanted to give you a little bit of a run-through of some of these things, and we have time for questions. So we can, so operator, you can turn it over for questions, and people can ask us questions or give us feedback or whatever they would like.
Thank you. We will now begin the question and answer session. If you do have a question, please press star, then 1 on your touch-tone phone. If you're using a speakerphone, you may need to pick up the handset before pressing the numbers. Once again, if you do have a question, please press star, then 1 on your touch-tone phone. At this time, I'm showing no audio questions.
Okay, thanks. And as I said, we would like your feedback on the site, so please feel free to email me with some answers to the questions on how would you use the site, have you used it, what are some gaps, any suggestions are most welcome. As I said, our goal was to give you some resources that are in the public domain that you can use for your companies to address the epidemic of diabetes and of prediabetes. Please click on the map to see if there is a Y in your area. And perhaps you could screen your folks for prediabetes and get them into a program. As Chris said, the return on investment is very impressive. Ron or Doris, anything to add?
Let's just check one more time if there's any questions that have surfaced from the group, or Pam, if there is a specific question that you'd like to ask of the group to see if they have an answer, either related to the Diabetes at Work website or whatever.
Well, I have two. One would be where do people usually get their education materials for their worksite programs on diabetes? And two, have any of the callers referred any of their patients to the WISE or the National Diabetes Prevention Program, and what their experience was?
So please, those of you that have logged on for the webinar today, feel free to give Dr. Allweiss some feedback, and we can get into a brief dialogue around those areas.
We do have an audio question. I have Maureen McCluskey online with a question. Please go ahead.
I was wondering if any of the work sites have had the national recognition from the CDC for their diabetes program.
For the National Diabetes Prevention Program?
Right. Mentioned that it's available for community, and I was wondering if it's something that the work sites also are applying for.
I will turn you over to Christina, and yes, they're working with the National Business Coalition on health. Chris, I'm going to put you on speaker. Hold on 1 minute. The question was, have any of the work sites applied for recognition for the National Diabetes Prevention Program?
At this point in time, we've not had any work sites per se apply. We've had a couple of gyms apply, some churches, and some health care systems, but no specific work sites as yet. That doesn't mean that that's not happening, because we hear that there are some that are planning to apply for recognition. And the first step is basically to do that, to complete the form, the application, which just asks for your basic demographic and the site that you'll be delivering the curriculum or the lifestyle change program. You have to agree to whatever curriculum you're going to use. Your curriculum must be approved if it's a curriculum other than the National Diabetes Prevention Program curriculum. But basically that's it, and then you start collecting de-identified data, and that's submitted to our program every 6 months. There is no fee, no application fee, and the cost to those that are applying for recognition is basically whatever the cost is of keeping the data.
Okay, great, Chris. Sounds like a lot of opportunity.
And I think the issue is probably reimbursement. We see that with diabetes education programs as well. Some that are American Diabetes Association approved programs have an easier time of getting reimbursed from the health plans, so that this is something. Some businesses have said they're interested in perhaps sending some people to be trained for the master trainer class. But I think it's more building an infrastructure where things are consistent so that the product delivered is a consistent type of product.
Thank you.
I'd be
Once again?
Yes.
Once again, if you do have a question on the phone, please press star then 1 on your touch-tone phone.
I'd be interested to know if any of you on the phone have any formal programs for people who have prediabetes. I know that many work sites have formal programs for people who already have diabetes or they have vendors. I'd be interested to know if any of you have any formal programs for people who have prediabetes. Because that's almost like that's a huge number of people, and we know that we have some very good interventions.
At this time, I'm showing no audio questions.
So, Pam, I think to that point, that's underscoring why there's such a great opportunity for some continued primary and secondary prevention activities around identifying those people with prediabetes. I think we've talked before that out of the 79 million people who do have prediabetes in the U.S., less than 10% of those people know it. And therefore, we need to do more secondary prevention, which is the screening detection aspect of things, and then get them involved in preventing the ongoing development of diabetes itself.
Exactly. We see a lot of programs that are doing screening for diabetes, and if they do find somebody who might have prediabetes, they need to think of it as a formal diagnosis and that something can be done. Unfortunately, many people will say, I have prediabetes or a touch of sugar or borderline diabetes, and that's like being a little pregnant. You either have it or you don't. People still can get complications. So it's an awareness thing, as you said, Ron, definitely.
We do have an additional question. I have Maureen McCluskey back online. Please go ahead. Maureen, please go ahead with your question.
Can you hear me?
Yes, now we can.
Okay. We're in the process of rolling out a diabetes program that will include pre-diabetics, and the curriculum will be somewhat similar in the educational lifestyle, with the diabetics getting more support when it comes to medication.
Okay, and certainly this is a great opportunity if you're going to be doing education to kind of, for the people who have diabetes, to look at the Diabetes at Work website, but also if they have pre-diabetes, to maybe instituting the 16-week class for those folks as well. So hopefully these resources can help you. And if you have any questions about adapting for your website, just for your work site, just email me and I'll be glad to help.
Thank you.
And I will post these questions in the discussion group on the H&P website. I'll send out a notice to the entire section, and we can have a dialogue on the discussion forum on the H&P website also.
Great. Thank you, Doris.
We have no further questions at this time.
Okay, well, thank you, Dr. Allweiss. Thank you, Christina. It's been an illuminating presentation over a very important topic that we're all needing to continue to improve upon how we can prevent. So with that, we wish everyone a great day and just continue the great work that you all do in helping make the world a healthier place. Thank you.
Thank you.
Thank you.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.